Hey, hello everyone. This is a very last minute impromptu live chat that I'm doing at the moment because I wanted to record this and put it up on my profile. And the reason why I thought I would do it as a recording so that if anyone wanted, they could hear it in terms of Ayurveda Pura courses and what it entails, especially if you were to study with me in terms of becoming an Ayurvedic practitioner. The reason why this has come about is because after I have posted about, like to study online or in person or completely online. So if you remember that particular story that I put up there. So following that, I have had a lot of people, potential students, inquire regarding to studying with me to become an Ayurvedic practitioner and understanding, how things work. And in terms of that, I thought I would clarify something, the way we offer courses and how those courses then can be compared to any other service providers out there. So while I was talking to people, I have come to know that many people, when they do offer Ayurvedic courses to study, they usually call it level 1, level 2 courses to become an Ayurvedic practitioner. So you will see that the way my academy, Ayurveda Pura Academy, offers courses, we don't call it level 1, level 2, level 3 or anything like that, because the whole structure of the course is slightly different from anyone else. So bearing that in mind, if you do want to become, as a topic over here says, a complete and a confident Ayurvedic practitioner, and if you're looking to study with me, then the 3 courses that you would need to do in terms of studying and becoming an Ayurvedic practitioner is, first of all, it's a Ayurvedic diet and lifestyle consultant course. The second one is the Ayurvedic therapist course. And once you've done these 2, then ultimately is the advanced Ayurvedic practitioner course. So these are the 3 main kind of, diploma courses, where at the end of it, yes, you will become a complete, successful and confident Ayurvedic practitioner. Now, why don't I call it level 1, level 2? Because having talked to many people and having researched online, I have now come to know that the first course, that is the Ayurvedic diet and lifestyle consultant course that we offer, or I offer at Ayurveda Pura Academy, is actually an equivalent of level 1 and level 2 that many other course providers do. Now, when I say level 1 and level 2, because I've talked to people who were wanting to study with me and they were quite surprised in terms of the depth with which I go in terms of teaching the diet and lifestyle consultant course. So from that point of view, also to understand that when the diet and lifestyle consultant course, when I say level 1 and level 2, in comparison to any other course providers, is because, yes, it is a year-long course. And during that course, I just don't cover the basics of Ayurveda, that is doshas or Prakriti, Vikriti, Ama, Agni. But along with that, a very important part of the diet and lifestyle consultant course is actually the Ayurvedic pulse diagnosis and tongue diagnosis. So and probably people who do practice Ayurveda already know that these are the 2 main, if you want to call it, diagnostic pillars or pillars of diagnostic techniques in Ayurveda. And I usually spend 5, sometimes even 6 days in Ayurvedic pulse diagnosis and tongue diagnosis, because once a person has got a good grip on that, then you will see that, then putting a therapy plan together, talking about next steps, management protocol, then becomes easy. So that is one thing that is included in my diet and lifestyle consultant course, which I know no other course provider actually provides or offers that. But the other very important thing which I have on comparison, I've got to know that when other people do their level 1 course, they don't actually include Panchakarma. And now in my diet and lifestyle consultant course, I do talk about Panchakarma, which is the Ayurvedic cleansing. Do bear in mind, it is an Ayurvedic cleanse program. Panchakarma is not a detox program, it is a cleanse program. So the term detox is something that we use when someone has ama in the body, which can be compared to toxins. And interestingly, Panchakarma is actually contraindicated if someone has ama. So Panchakarma is not a detox, it is a cleansing program. So actually I talk about in depth about Panchakarma in the diet and lifestyle consultant course. And so when I talk about in-depth, really understanding the principles behind it, the various aspects of Panchakarma, that is Purva Karma, Pradhana Karma, Paschat Karma, but then also understanding, of course, all of this is knowledge, but then how do you make it practical? So I also go through designing, and making the students understand how they can put together a 9-day Panchakarma program, 14-day, 21-day. And while I'm talking about that, please do understand that there is no Panchakarma. I know many people do provide out there as clinics and practices. There is no 3-day Panchakarma. There is no 5-day Panchakarma. There is no 7-day. You need at least 9 days. Probably what they are providing in those 3, 4 or 5 days is maybe Purva Karma, only all therapies. But then you can't call it Panchakarma. But anyway, coming back to the Diet and Lifestyle Consultant course, I do talk about Panchakarma in detail, and for them to take away, so that even if they want to just practice as an Ayurvedic consultant or Diet and Lifestyle Consultant, they can very confidently go away and do that. But once again, in the Diet and Lifestyle Consultant course, which in reality now that I've researched is a combination of level 1 and level 2 of what many others provide, in that I also then talk about dhatus, that is tissues in detail, or even shrotas in detail, really understanding what ojas, tejas, prana are. Then also understanding all the various manual therapies of, indications, contraindications, and also how to put a therapy plan together. And I also talk about herbs in detail, the most important herbs that are really needed nowadays. So that is all that I cover in the Diet and Lifestyle Consultant program, which, and I'm repeating again, it appears to be that it is level 1 and level 2 of what many others provide. So once you've done the Diet and Lifestyle Consultant course, then comes a Ayurvedic Therapist course. The moment we use the term therapist, it is actually manual therapies. So in the Ayurvedic Therapist course, this is a course that is where you learn all types of Ayurvedic therapies. That is authentic, classical, traditional Ayurvedic manual therapies, including the basics like Sarvanga Bhyanga or Shirodhara, Mukha Bhyanga, Prishta Bhyanga, Hasta Bhyanga, like all massages, but also manual therapies. What are manual therapies for us? Things like Shirodhara, because it's a technique. Basi therapies, then Pindasveda, Udvarchana. Do understand that one thing that I've also noticed is that not many people seem to train their students in Akshitarpana, Karnapurana, which are also quite essential therapies, and this is something that I cover in the Ayurvedic Therapist course. So that is the Therapist course. And do bear in mind that, of course, in terms of completion, it takes 6 months to complete the Ayurvedic Therapist course, but you come here. When I say here, I'm actually sat in my yoga studio part of the Ayurveda Pura Spa or Health Center, and this is where I teach from, and I'm literally pointing out to the hall over there in front of me because that is where all the students sit. And so yes, it is an in-person hands-on practice course, and for me that bit is really important, because you will see that yes, the more I've been researching, a lot of people are now actually teaching Ayurvedic therapies online. And I'm going to put my hands together and say, for me, I'm not comfortable with that personally, because if you're just learning just for your own self-massage, self-technique, self-help, whatever, I understand. But if someone is looking to go away and practice that on someone else, when the way I do the therapist course is first I demonstrate the treatment, then the students, they practice on each other. But I don't leave my students to themselves to practice. I'm actually observing all the time. So it's supervised training. And during that supervised training, then if I see that they're doing something that they shouldn't be doing, or somewhere that they can improve the technique, or understanding how to tailor make the massages or manual therapies for Vata, Pitta, Kapha imbalances, then all of that is done over here in person. So it is a 10 days in-person course over here. So people come here for 10 days every day. And that is when on day 1, I also tell all my students is that today is day 1 and day 10 will look like a really long way away. But before you know, that day 10 will also come. But then it is almost like receiving Panchakarma, because, it's like all the manual therapies bit of it. And I'm really grateful. I need to touch wood over here, because a lot of students at the end of those 10 days, they say, Dr. Deepa, you won't believe, but I used to have this lower back sciatica. It is not there anymore. I suffer from IBS, but my bowel movements seem to be more regulated. I used to suffer from insomnia. There is no insomnia anymore. So it's like even those 10 days of therapies that they've come here to learn, because everyone is receiving and giving the therapies, people also see a big change. So it's almost like a different kind of Panchakarma that they've received. So after those 10 days, then after that, for the next 4 or 5 months, then We do like online meetups with all the students, because for me, case studies, going away and practicing is very important. So if people ever have questions about, what, I have this client who seems to be having vata excess but insomnia or skin condition, can you suggest what therapies I can give them? So I'm there for help or support for the students during the case studies, and hence through that we also do online meetups once a month, and altogether then that is a 6-month program. So now once someone has done the diet and lifestyle consultant course, which is level 1 and 2, when you were to compare to all the other courses outside, and then comes Ayurvedic therapist course, which is level 3, then comes the advanced Ayurvedic practitioner course, for which when I were to compare, it is actually level 4. Now in the past, before when I started offering the advanced Ayurvedic practitioner course, I of course then students from other institutes also joined, but then that is when I realized that actually I'm being unfair to them, because they come here on day 1, and for everything that I've covered in the diet and lifestyle consultant course, therapist course, on day 1 of the advanced Ayurvedic practitioner course, and what my students do is we spend that one day where students are doing consultations on each other, then which includes things like they've done a full, like, I'm sure people who have studied medicine or authentic traditional Ayurveda, there are 4 aspects to any consultation. First is history taking, so we ask questions, then observation, then palpation, that is where pulse diagnosis and everything comes, and then auscultation. So through auscultation it means hearing sounds, but it is to do with that sound related changes or diagnostics. So they follow all of that, they're checking the pulse, looking at the tongue, then based on that then they decide, okay fine, for you this herb, this massage, this food will really help. And on day 1 of the advanced practitioner course, then we discuss the case study. So student A would have done a consultation on student B, then they swap over, and then through that, hello, hi Seema, nice to see you here again. And then they swap each other in terms of consultation, but then we discuss, okay fine, you've done this consultation, so when you were checking the pulse, did you get to know the status of the dhatus, status of their organs, or any emotional status, understanding all of that, and we actually have a discussion as to how they can take that plan forward. So on day 1, if someone wants to come and join the advanced practitioner course, if they have not done pulse diagnosis, understanding shrotas or panchakarma, dhatus and everything, then I know that they will not feel confident about the advanced practitioner course, and hence that is how I changed that. If someone wants to do the advanced Ayurvedic practitioner course with me, then they would need to do level 1 and 2, which is diet and lifestyle consultant course, level 3, which is a therapist course, then comes the advanced practitioner course. People do ask me, so what does the Ayurvedic advanced practitioner course entail? Now that includes a lot, and it is amazing because I do go in depth. So in the level 1 and 2, people have done pulse diagnosis, tongue diagnosis. It's quite a lot. But then now in the advanced practitioner course, I do advanced pulse diagnosis, advanced tongue diagnosis, and also Ayurvedic facial diagnosis. So that is the diagnostic side of it. But then also in the advanced Ayurvedic practitioner course, we talk now about panchakarma in detail. How? It's not just, how to do panchakarma for a client, but tailor-made panchakarma for, let's say, panchakarma for rheumatoid arthritis, panchakarma for infertility, panchakarma for people suffering from multiple sclerosis, IBS, underactive thyroid, or panchakarma tailor-made for psoriasis. So understanding, so in that also then understanding what oils to use, or on the day of Virachan, that is purgation, what is a herb mix that they could use, what kind of therapies and would be more tailor-made in the Purva Karma time, or again if it is Basi therapy, that is internal enema therapies, and what kind of decoction recipes to use. So all of that is what we go in terms of the through in terms of the panchakarma in the advanced practitioner course. But then along with that, for me it's the last, and yes, also then looking into imbalances of dhatus and more tailor-made, more focused remedy or management of tissue imbalances. So in Ayurveda, we have got something less, rasa dhatu vriddhi, or mamsa dhatu kshaya, or majja dhatu dushti. So, and I'm purposely using all these Ayurvedic terms because people who've studied Ayurveda with me, or even otherwise, I'm hoping they'll know those. So yes, rasa dhatu vriddhi is plasma tissue excess. Mamsa dhatu kshaya is muscle tissue imbalance or reduction, or majja dhatu dushti is nothing but ama in the nervous tissue. So when people come with various of these dhatu imbalances, then how to tailor make your therapy plan so that you directly target to get rid of that imbalance. Likewise, we talk about all the shrotamshis, that is, shrota related or channel related imbalances too. But then the last 2 modules of the advanced practitioner courses, which I love the most, because during those last 2 modules, we go through all the ailments and a management protocol for all the illnesses and diseases. So for example, what is a management protocol for rheumatoid arthritis or psoriasis? When people talk about psoriasis, people think, oh, this is a pitta excess illness, pitta imbalance. But according to Ayurveda, that is wrong, because it's just not pitta excess. Just to make it simple for now, part of this live chat, just to let you know, yes, psoriasis may be either vata, pitta or kapha related, but there may be many other types of psoriasis too. And hence, if someone came to me with a vata related psoriasis, and if in my head I'm thinking, oh, that is a pitta imbalance, now will reduce pitta in that person, I'm actually causing more problems, because by reducing pitta, I'm increasing coldness in the body. That means the psoriasis will become worse. So understanding the different types of illnesses and imbalances according to Ayurveda, and then accordingly what the management protocol or therapy plan, the way you would put it or take it forward. So we go through many illnesses. Literally, I say, we've got approximately 14 body or systems, physiological systems, your nervous system, your digestive system, respiratory system, cardiovascular system, reproductive system, urinary system, skeletal system, muscular system, lymphatic system, endocrine system. It's literally top of the head. I've mentioned some, but then along with that, even for us, it is a system in a way, all the 5 sensory functions. So understanding illnesses of all of these and management protocol for all of those. Not only that, in the advanced practitioner course, I literally start from the beginning, meaning pregnancy. So if someone came to you being pregnant, imbalances during pregnancy, then children's illnesses, imbalances, and how to correct those. So yes, the advanced practitioner course is quite in depth and covers a lot. And I promise you that if you were to study all these 3 courses with me, you will have all the tools, all the kind of, help at hand to actually go away to practice confidently. So these are all the various courses that I actually offer if you want to become a complete, proper, confident Ayurvedic practitioner. And I usually tell people, the way I'm very confident every time a client walks in saying, okay, fine, consultation, even though I may have never seen them before, but I'm very confident that yes, Ayurveda will help them. And do bear in mind, for me, and this is what I tell all my students, for me, Ayurveda is second nature. For me, it is not a conditioned reaction. It is an unconditioned, inherent, natural reaction. So if you woke me up 2 a.m. in the morning saying, can you please tell me what is a therapy protocol or treatment management protocol for someone with systemic lupus or someone with HPV or someone with motor neuron disease or anything like that, I'm very grateful and thanking God and thanking my professors from back in India. The way they taught me, I can actually tell you without any hesitation what the management protocol will be. And this is what I tell all my students, that this is how I want them to become confident too. And from that point of view, of course, yes, most of these courses are usually taught in person. And coming back to the first thing that I started off with, do bear in mind that with all of these courses, some elements of these courses can be done online. But for this, I'm actually going to put my hands together and say there are certain aspects which need to be done in person. And that aspect is usually Ayurvedic pulse diagnosis, tongue diagnosis, so diagnostics. And the other thing that I do prefer that people would do it in person is the hands-on therapies or manual therapies training. Because being in person, because it's not just about getting to know each other as colleagues. For me, I feel that it is my responsibility as a teacher to make sure that the student takes away the right kind of information. So the way some of these courses that we have started designing, yes, you can do some of those online, but some parts of it will have to be done in person. And I do know that sometimes people will say that online course or in person, how to make someone a really good practitioner. And I guarantee you, I've got my ways of making sure that all my students are studying, because what we do is we have assignments regularly. And even if you were to be studying online, I will make sure that you've read everything, because the way we do assignments every morning before you start the class, we do assignments, and everything that you answer in the assignments then becomes a part of your final assessment, because that is how then you put all your focus into studying. So whenever anyone joins my courses, I always tell them, remember that it is my responsibility and duty to make sure that they have studied well, they have understood well, and they go away feeling confident. So I thought I would do this live chat, because first I thought I would record it and put it up there, but I didn't have time to do it. So I'm literally teaching. I've been teaching earlier today, taking a break now and going back to work again. But I thought, I would just talk about it all. Okay, so just to let you know, just as a recap, if you're ever looking to study to become an Ayurvedic practitioner, or rather 4 level courses, level 1 and level 2 is the Diet and Lifestyle Consultant course, level 3 is the Ayurvedic Therapist course, and level 4 is the Advanced Ayurvedic Practitioner course. So these are all the things. When put together, I can guarantee you will feel very confident in your Ayurvedic practice. Okay, so that was for today, and if anyone does have a question, do ask. I don't really know what the exact time is because I need to get going, but still, I'll just wait for a few seconds, couple of minutes, to see if anyone has got any questions about courses. Bear in mind, today I'm just talking about courses, nothing else. So if at all, do ask me, or you can always send an email or message me, or if you're going to be emailing, do email academy@ayurvedapura.com, and all the information will be sent across to you. Okay, so I guess I'm going to stop here, and I don't know, I might just end up doing another impromptu live chat, because I like it, rather than, putting it up there, waiting for people to join and everything, which is also good, but sometimes impromptu, last minute live chats sometimes are really good. Okay, so hope you all have a great day on your side, and I'm sure I will be in touch with many of you again soon. Anyway, have a good day. Take care. Bye.